finding the most effective depression treatment for you. When you're depressed, it can feel as if you'll never be free of the darkness. Even the most severe depression, however, can be treated. Don't hesitate to seek assistance if your depression is preventing you from enjoying the life you want. There are numerous treatment options available, ranging from therapy to medicine to healthy lifestyle modifications. Of all, just as no two people are affected by depression in the same manner, no one-size-fits-all treatment for depression exists. What is effective for one individual may not be effective for another. You can identify the remedies that can benefit you by becoming as informed as possible. Depression treatment tips. Find out everything you can about your depression. It's critical to figure out whether your depressive symptoms are caused by a medical problem. If that's the case, you'll need to address it first. Your depression's severity is also a factor. The more serious your depression is, the more intensive your treatment will be. Finding the appropriate treatment takes time. Finding the treatment and support that works best for you may take some trial and error. If you decide to go to therapy, for example, it may take a few tries to locate a therapist with whom you connect. Alternatively, you may try an antidepressant only to discover that you don't require it if you exercise for half an hour every day. Don't rely solely on drugs. Although medicine can help with depression symptoms, it is not normally recommended for long-term use. Other treatments, including as exercise and therapy, can be as helpful as or even more so than medicine, but without the negative side effects. If you do decide to attempt medication, keep in mind that it works best when combined with healthy lifestyle modifications. Obtain social assistance. The more social ties you have, the less likely you are to become depressed. If you're stuck, reach out to trustworthy family members or friends, or look for new connections at a depression support group, for example. Requesting assistance is not a show of weakness, and it does not imply that you are a burden to others. The simple act of talking to someone face to face can often be really beneficial. Treatment necessitates patience and dedication. All of these depression therapies require time, and they can feel overwhelming or painfully sluggish at times. That's quite typical. Recovery is prone to ups and downs. Depression can be treated by altering one's lifestyle. Exercise can be just as effective as medication in treating depression. Exercise, like antidepressants, increases serotonin, endorphins, and other feel-good brain chemicals while also stimulating the creation of new brain cells and connections. The best part is that you don't have to train for a marathon to gain the benefits. Even a half-hour stroll every day can make a significant effect. Aim for 30 to 60 minutes of aerobic activity on most days for best effects. Support from others. Isolation, a major risk factor for depression, is reduced by strong social networks. Keep in touch with friends and family on a regular basis, or consider joining a class or group. It is critical to eat healthy for both your physical and emotional well-being. Small, well-balanced meals spread out throughout the day will help you maintain your energy and reduce mood swings. While sugary foods may appeal to you because they provide an immediate boost, complex carbs are a superior option. They'll get you moving without the sugar crash that comes with it. Sleep has a significant impact on one's mood. Your depression symptoms will worsen if you don't get enough sleep. Irritability, moodiness, depression, and weariness are all exacerbated by sleep deprivation. Make sure you get enough rest every night. Few people can function successfully on fewer than 7 hours of sleep per night. Aim for between 7 and 9 hours of sleep per night. Reduction of stress. Make lifestyle changes to help you manage and reduce stress. Excessive stress exacerbates depression and puts you at risk of developing depression in the future, so avoid it.